Hello, people. I hope you're enjoying your holidays and warming up for a fantastic new year. Today, I'm going to cover enteral nutritional devices or feeding devices. Simply put, enteral nutrition is any nutrition that goes through the gastrointestinal tract. If for any reason, maybe a disease, a trauma, or an abnormality, a patient is not able to feed normally through the GI tube, it becomes necessary to use devices called enteral access devices to feed the patient or get him nutrition. So essentially, there are four types of these kind of devices. The one that goes through the nose, the one that goes through the mouth, the one that goes directly into the stomach by making an incision on the abdomen, and then the one that goes directly into the small intestine by making an incision in the abdomen. So I'm going to go over them briefly and their variants, and then we'll talk about nursing implications for these devices. Number one is the NG tube. So there's the NG tube that goes to from the nose to the stomach, and then there is the tube that goes from the nose to the duodenum, that's ND tube. There is the one that goes from the nose to the jejunum, that's NJ tube. Then for the ones that go through the mouth, we have the orogastric tube, just as the name implies, from the mouth to the stomach. We also have the one that goes to the small intestine, either the duodenum or the jejunum. We also have the tubes that do that. Then I know back home, at least in my practice, the only thing I was exposed to was the NG tube, just the NG tube. These other ones I didn't get to use them. But over here, there is this option. So apart from these orogastric tube, the ones from the mouth to the small intestine, there is also the Dopphoff. The Dopphoff goes from the nose to the stomach, but it is not the same kind of tube. It is thinner than the NG tube. Sorry, I'm going back and forth. I don't want to forget it. So the Dopphoff goes from the nose. It's just like NG tube, but it's not NG tube. It's thinner and it's white. The NG tube is transparent, but this one is white in color. It's thinner, graduated also, and it is sent from the nose into the stomach, and it is bridled. There is a rope they use to attach to the back of the throat and then attach it to the front of the NGF or the Dopphoff so that it does not dislodge. So that's for the Dopphoff. Now let's continue. I talked about NG and its variants, and I talked about OG and its variants. Now let's continue. Number 3, gastrostomy tube. These tubes, they are sent directly into the stomach or the intestines by making an incision on the abdomen and then sending them through the abdominal muscles into the stomach or into the jejunum or into the duodenum, depending on where they want it to go. So those are these tubes. Now, the reason why the most common one by far is the gastrostomy tube, because it's used long term. Some people use it for years even. Especially people who have maybe throat cancer or anything that is going on in their throat or mouth that does not allow them swallow, and they have to be treated for a long time. So they put that OG tube in there and they feed through it until they recover enough to use their normal, GIT. So I want to mention a few things. This gastrostomy tube, they call it G tube. Sometimes you hear them call it PEG tube. In fact, you hear them call it PEG tube more often than not. Now, the PEG tube is a form of the G tube. They are just the same thing. The only difference is the procedure through which they are inserted. The PEG tube, that's percutaneous endoscopic gastrostomy tube. Just as the name implies, it is inserted endoscopically. So they use endoscopy to, send it in. But the regular G tube, they make an incision on the abdomen and send it into the stomach. So that's the only, if you look at them, they look like the same thing. People even call them, the names are called interchangeably, but just know that that's just the only difference there. Apart from that, it's essentially the same tube. So I have covered all that. Now, these tubes, you can send in medications, you can send in feeding, you can remove gastric contents via these tubes, all of them. Now, you will notice that some of the tubes have 2 ports. In short, they have at least 2 ports. One port will be maybe going to the stomach or duodenum, whichever one. The other port is a balloon pilot port. Let me put it that way. So don't mess with that one. That's what they use to secure the balloon that keeps it in place. So you will see it labeled on it there. It's labeled. So you don't need to, put the feeding in where the balloon is supposed to be. Then there are other types that have a port for gastric, a port for duodenum. So look at it. You may be given instructions in your order that put medications here, or don't put it here, or put feeding here, or don't put it here, depending on the goal of treatment. So look at the orders and make sure you know what you are supposed to do. Now, another thing I want to point out is the feeding. There are feeding formulas that is being fed to patients through these tubes. So they have different names. Agevity, ProSource, their names are different. So make sure that if you are setting it up, look at your order, which one you are supposed to set up for the patient. And it can be bolus. You can give it bolus by using a syringe to push it in, or you can give it gravity by attaching a syringe to it and allow gravity to push it in, or you can use a feeding pump. There are pumps that are used to feed patients. So you attach the formula to the pump, and then there's a tube that sends it right into the patient. So depending on what you are asked to do, you do it. Sometimes these tubes are used for decompression. So they are either attached to suction or gravity. Again, look at your orders to know which one is which. Now, let's quickly look at the nursing implications. The video is getting too long. The nursing implication: you should clean the tube, the ports, clean it. The site where it is coming from, I'm talking specifically about the abdominal ones. You clean it. Before you give medications or feeding, you flush it with sterile water or just normal water, according to the orders once again. Flush before and after. The pumps are programmed to flush also. So take note of that. Then, another thing is, I've talked about the balloon, and then there are some medications that are extended release or time release that you're not supposed to crush and put in that. So take note of that. I'm going to stop here. Make sure to like, share, subscribe, and follow for more.